morning. Today we'll be talking about closing the care gap. Thank you, Your Excellency. It is a pleasure to have you on the program. Dr. Shinkafi Bagudu, as the wife of the governor of Kebbi State, well-known practitioner and advocate for cancer. It's a pleasure to have you with us, as well as Dr. Adamu Hassan Umar, who is the president of the Nigerian Cancer Society. So if we may, Dr. Shinkafi Bagudu, can I just dive in and ask you, what is cancer and what causes it?
Okay, hello everyone, and Dr. Pamela Ajayi. It's a pleasure to be here talking about cancer, which, as you say, is an integral part of my professional and even non-professional life. I have been advocating in the cancer space for the last 15 years now. And of course, one of the common questions that you get asked, first of all, is what exactly is this cancer? There can be various interpretations, but technically or scientifically, cancer is when the abnormal mechanisms that control body growth or the cells in the body goes out of sync. So what it means that every cell, the human body is made up of trillions of cells, which make up the organs. Every cell has a natural way of progressing. It grows, it undergoes some changes, and then it goes off naturally. It's killed off naturally. We have things like natural killer cells and various processes that can, that regulates this. And it's a very intricate and complicated system. But when this goes out of coordination or becomes uncoordinated, then the cells begin to grow in an abnormal way, in an unregulated way, and in a way that is harmful to the human body. So basically, this is what is known as cancer. What this means is that every living cell is capable of having cancer. And so when you think about the human body, every cell that is fed by blood can have cancer. Those are the living cells. There are some parts of the human body that are not living, but are parts of us. For instance, the nails, the hair. These, you never hear of cancer of the hair or cancer of the nail or the teeth, but you can have carcinoma in the gums, in the scalp lining. And of course, when you think of nails, the bones and the flesh, you have all these cancers. So any cell that is living is capable of developing cancer. So that is what cancer is basically.
Oh, so do we know what causes cancer? Or what puts people at risk of having cancer?
For some of them, the basic underlying thing is an abnormality in the regulatory systems, and the triggers for this abnormality varies. For some of them, there are specific triggers that we know of. The commonest, of course, that we talk about is the HPV virus. Some infectious diseases, infectious agents can trigger this abnormality that happens at a later stage in life. So we know some of these factors, such as HPV virus causing cervical cancer. Radiation is a known trigger. Aging is a known trigger. There are some risk factors that are associated with various cancers. Women are more likely to get breast cancer, and so on. Of course, if you don't have an endometrium, you're not going to have endometrial cancer. So that is a risk factor. Sex becomes a risk factor. And like I said, the aging process. Aside from environmental toxins and agents, you also have some known chemicals that can be found in food, some fungus. Aflatoxins is a common causative agent of liver cancer. And but what I must say at this point, it's not like I don't want to give the impression that everybody that gets, for instance, the HPV virus is going to end up getting cancer of the cervix. No, there's an intricate mechanism depending on genetics, depending on your body responses, environmental responses, the defense mechanisms that you have been exposed to, Has the person received the vaccine? Does the person have an appropriate nutrition? And I'm not talking about the nutrition at a particular age in life when you expect to get a certain cancer. It's the underlying building nutrition of the human body, how efficient that has been. So normally we talk about the things that we need to do to avoid cancer, and in blankets we talk about smoking, we talk about lifestyle, the way you live your life. Is it an active or sedentary lifestyle? It begs to reason that those with a more active lifestyle and a healthier diet are going to be less prone to developing cancer. And then alcohol is another one. So these are general positive factors that can be linked to the risk, higher risk of developing cancer.
Now, what are the most common kinds of cancer in our own environment here in Nigeria?
Okay, so that's a good one. The commonest cancer worldwide, and indeed Nigeria, is breast cancer. Breast cancer tops the list, and this is followed by, at the moment, prostate cancer. Usually it's breast, cervical, and then prostate. But the last 2020 Global Count, which is the global statistics body that records the incidence, so it overtook cervical cancer by a little bit, not much, but it could also mean that there's more awareness and so on around the prostate. So it's breast cancer, cervical cancer, and then prostate cancer. In the Caucasian population, the leading cancer is lung cancer, and then skin cancers are also very common. So to diagnose cancer is usually, it can be incidental or from like from a general medical examination or from the patient developing symptoms. Unfortunately for us, over 90% of our cases come in the late stages, so they are symptomatic. They usually have a big lump in the breast, or they have discharging, from the vagina, bleeding and things like that. But we encourage people to have regular medical checks, and then we can screen for some cancers. It would help a great deal if we're able to detect cancers at an earlier stage. Cancer can be staged into stage 1 to 4 normally for most of them, by stage 4 being the more advanced one that has spread, and stage 1 is still confined to the primary organ. So if we screen, these are tests that just look at the general well-being of that particular organ. In the case of breasts, we can have breast ultrasound. We start from advocating for young girls and all women and even men, because 1% of breast cancer does occur in men. So to examine their breasts for a lump, these are the common signs, and this is the way it can be diagnosed. Then the next stage after the self-examination, or in case of men, the testis, feeling a lump and so on. But if we come to the specifics now, then there are hospital-based tests that need to be done. For instance, ultrasound scans, mammograms, further x-rays, and so on. There are quite a lot of tests. Then you also have specific blood tests that can detect what are known as tumor markers in the blood that will indicate that there is a cell that is producing this abnormality. This was a very big discovery for cancer, and it helped greatly in the management of the disease. The discovery of the tumor markers, when there are certain either hormones or enzymes that are being produced in excess, then we can use this to not just diagnose, but to also monitor the progression or regression, as the case may be, of the disease. Another common one, of course, is the prostate-specific antigen, which is known the PSA, which is a tumor marker for prostate cancer. And men from the age of, in our environment, because it starts earlier, we encourage men from the age of 35 to actually start screening with the PSA. It's a simple blood test, and there are many others like this that can be done. There are some places that you can go to get a proper cancer check specifically, and they will just do a blanket everything. Then, of course, we have the imaging, such as the CT scan, the full body scan, MRI scans. All this will help us. But for us now, the most important thing is the prevention and also the early detection.
Thank you. And how about treatment? Is treatment available,
yes,
readily available?
About that. Well, like most parts of our health system, it is not adequate in the least. Yes, treatment is available is the straight answer to your question. But like you said in the beginning, the reason we're here today is to discuss this year's World Cancer Day, or is part of this year's World Cancer Day. And the theme for the World Cancer Day is Close the Care Gap. And this, the World Cancer Day is a Union for International Cancer Control-led program that was started about 13 years ago and has evolved into its own, in collaboration with the WHO. And it's a day that is set aside to focus on issues in cancer. So starting this year, for the next 3 years, we're going to be focusing on the theme, Closing the Care Gap in Cancer. And this campaign is not just talking about the care gap or the inequities that exist between either the high and low income countries, but what is the care gap? How do we, and this cuts across the entire continuum of cancer care, right from screening, from prevention, to treatment, to palliative care, and of course, all the modalities of treatment. So between sexes, in country, between regions, are there people that are more predisposed to certain cancers? So we want to focus the campaign that will teach them about that cancer and how to detect it earlier. We know that there are gross inequities across our health systems, and how do we work together to help to close this as it relates to cancer? So to finish the question, there are treatment modalities such as surgery, then you have chemotherapy, and the final one is usually radiotherapy. All of this exists in Nigeria, but definitely not in adequate quantities or in the proximity that we want it to be for the patients to be able to access it. The other issue is the obvious funding issue. People can sometimes have the facility that can provide radiotherapy, for instance, in a distance that is accessible for them easily, but can they afford it? That's another whole conversation on its own.
Dr. Adamu, can you tell us what are the kinds of inequities that we face here in Nigeria? How can we close the inequity gap?
Well, good morning, and thank you for having us on this program. Her Excellency, in her closing remarks, has itemized the 3 golden A's. We refer to them as the 3 golden A's. We are talking about availability, accessibility, and affordability. These are the 3 core components, particularly as it concerns cancer care, particularly in our country, Nigeria. Now, Nigeria is a country that has over 50% of the population living below the poverty line. Another 50% living in rural areas. And when you look at the distribution of healthcare facilities, particularly the sophisticated healthcare facilities that provide the sophisticated form of care, they are all concentrated in the urban areas. And again, you look at the budgetary allocation to health. Yeah, of course, I don't want to delve into that, but what we are saying here is the fact that the inequities are all over the place in Nigeria. You know, you talk about the purchasing power of households, you talk about the poverty line that I spoke about 50% of individuals in that category. And that is the reason why, at least for cancer care, we have issues. We have a lot of challenges in addressing the 3 golden A's. Availability of the healthcare equipment, the healthcare personnel, the healthcare facilities is one thing. Accessibility, of course, you know how our, particularly the rural areas, how they are. Access to healthcare, you go to some hospitals in rural communities, you look at the kind of ambulances they are using. In some places, they are using carts to bring emergencies to the hospital. So and that is their local ambulance. And up to now, Nigeria doesn't have a standard ambulance system that is operational in other developed countries. And even where there is, the access to healthcare facilities another challenge. And now, the major issue, again, talking about the purchasing power of households, talking about the poverty line, is the affordability of these, particularly as regards to cancer services. As rightly stated by Her Excellency, the different modalities of care when it comes to treatment for cancer, it's not just for one to have the surgery, and depending on the stage. Surgery is one. You need to undergo chemotherapy, you need to undergo palliation, you need to undergo a lot of things. And again, considering the fact that cancer is one entity, that is one disease entity that requires a multidisciplinary approach to management. The oncologist, the nurse, the nurses, the access, the awareness at the level of the family that is needed for these patients to come to the hospital early. Her Excellency mentioned the issue of early presentation, which is key to care, particularly as it regards to cancer, because you have a situation whereby most of the cases you see, particularly coming from rural communities, are already at an advanced stage of the disease. And that makes it very difficult for the healthcare practitioners to take care of. And the bottom line about what we do in the Nigerian cancer space is the fact that most of these common cancers, as highlighted by Her Excellency, talking about breast cancer, talking about prostate cancer, talking about cervical cancer, most of these common cancers, one type of them are preventable. And in medicine we say prevention is better than cure. But how do you prevent a disease without being informed fully? And again, another type of these cancers are curable, of course, when detected early. You see, so it means that when we don't address the health inequities that exist in our environment, when we don't address the issue of universal access to care through probably universal health coverage, Nigeria is a country that has been operating the National Health Insurance Scheme that is the sole preserve of the federal government workers. Even at that, when you look at the percentage population, the National Health Insurance Scheme is covering less than 10% of the entire population of Nigeria. And that is a major problem when it comes to equality of care, when it comes to equitable distribution of healthcare to individuals. The non-formal sector of the health insurance scheme is being neglected. And this is the reason why you have a lot of issues regarding access to care. You have a lot of issues regarding equitable distribution of healthcare facilities and the necessary equipment in our country. And these are the issues that we continue to engage policymakers. We continue to engage potential individuals and organizations that are willing to key into the system to be able to address these health inequities. So as rightly stated by Her Excellency, as from this year, we will begin to understand, we will begin to bring to light all these health inequities that cut across communities, that cut across societies, that cut across the country, that cut across the African continent. And of course, we now compare and contrast with other developed countries to see where we are lagging behind, to see what we need to do to address these health challenges. Because it is very important as a country that we should have affordable, accessible, healthcare to all indigents. And that is the reason why we always push for universal health coverage for all Nigerians. It is possible.
Thank you. Yeah, thank you. If I can ask Her Excellency, Dr. Zainab Shinkafi Bagudu, can you tell us, because as you are now the president of the First Ladies Against Cancer, can you tell us what it is that your group, I know you have been very active, what it is you're doing to actually help to solve these gaps?
Okay, the First Ladies Against Cancer of Nigeria, which I chair, is the coalition of governors' wives that are involved in cancer care in any form whatsoever, be it advocacy, treatment support, and other provision of developing human capacity. I must emphasize that the governors' wives are both current and spouses of former governors. So it's meant to be a lifetime membership. and your foundation has to be involved in some aspect of cancer care. FLAG focuses mainly on awareness, particularly at the grassroots. We have spent a lot of time talking about the importance of awareness and prevention, as well as educating our grassroots population on the things that we've spoken about, the common signs and symptoms and prevention of cancer. The other thing that FLAG focuses on is high-level policy advocacy. There are some government policies that using that platform, we're able to call for influenced universal health coverage, health insurance, and so on. There are always many issues that can be done better with the right type of advocates. So this is what FLAG does. We organize workshops, we organize town hall meetings. Screenings are a very big part of what we do in FLAG, organizing especially for breast and cervical cancer screening in our primary health care centers, and generally making sure that our people are aware. The office offers a good platform to be able to reach out to the inner parts of Nigeria, that as the leader, for instance, Dr. Adamu, as the head of the Nigerian Cancer Society, might not be able, the cancer societies that belong to the organization might not be able to permeate to each local government the way a first lady in her state can do. So yes. This is the rationale behind FLAG. And we have been doing
great. No, that's great. Thank you very much for that. Now, we do know that, you know, one of the big issues that you have both highlighted is the fact that funding is an issue. And I do know that the Healthcare Federation amongst of Nigeria, amongst several others, including Medicaid, worked tirelessly to ensure that there's a cancer health fund that has been created for this purpose. Can you tell us a bit about that and how that should impact, or hopefully will impact, our clients or our patients going forward?
So the Cancer Health Fund is a fund that was created after a lot of push from various advocates that you see across cancer stakeholders. And it was mainly to push the federal government to set aside a certain amount in the budget that will be devoted to cancer care and used by indigent patients for their treatment. So that is the way the fund stands now. The sum of, I think, about 730 million naira was appropriated and released in the 2020 budget. So this was the first time, and it's a very laudable, it was a laudable thing to do by the government to actually release these funds to the Federal Ministry of Health and onwards to the teaching hospitals so that the patients that have cancer can access them. And this, the process has been ongoing, and I think we're at the end of, we're seeing the end of the tunnel now. The money is actually in the teaching hospitals in their e-wallets, and the patients have been selected. They had to apply in an online selection, and there were certain criteria that were met, and each hospital is in control of their own funds, and the patients will definitely either they have received or are in the process of receiving the amounts that have been allocated to them. So
that's wonderful. Yeah. And I think also the important thing for us is also to say it's laudable that it's in the teaching hospitals, but I think it's also important that it also gets into the private sector, into some of the excellent, very excellent cancer facilities that we have now. We don't have much time, and I wanted to also talk about the new tax, the sin tax that has come into force in Nigeria, where there's a tax on sugar drinks, because I'm aware that there's a push from the stakeholders to have it brought in to be used for cancer. Can you tell us about that?
Yes, well, thank you very much. Well, the poor health tax, that is the sin tax you're talking about, you know, is a creation of law. You know, it came as a result of the passage of the 2022 Appropriation Act and of course, the Finance Act as passed by the National Assembly, which was assented to by the President. And this act undergoes review from time to time. And this is, you know, a phase in the process. You know, it has started, you know, with the introduction of tax on tobacco products and alcohol and what have you. you. Now we are on to, sweetened beverages. That's the sugary drinks we are talking about. Now, this is a good omen for Nigeria, because this is a tax that has been operational in other developed countries. And of course, the revenue generated therein, adding value to the, entire GDP of such countries, and Nigeria will not be different. And I think it is something that should be welcomed by all indigenous, by all the population of Nigeria, because it will go a long way, in addressing a lot of the inequities we talked about earlier. Now, when you look at the health budget in Nigeria, Nigeria being one of the, African Union countries that has committed to allocate 15% of its budget to health, which has still remained a mirage. Even this year, we are still talking about 5% or less than that. Now, introduction of this kind of taxes will go a long way in adding, revenue, particularly to the healthcare sector, because these sugary drinks, have a lot of detrimental effects on the non-communicable diseases, diabetes mellitus, cancer being one, hypertension, and whatnot. So it is a welcome development for us as advocates, and we hope that the process will continue. We hope that there will be, a cascade of events that will lead to, further introduction of more taxes that will discourage people from taking these sugary drinks, that will, of course, add value from the, tons of money that these companies are making from, because we are all addicted in one way or the other to this sugary drink. So if people must drink, then let the companies or the beverages be taxed appropriately, so that the health sector particularly will benefit towards alleviating the sufferings, of these non-communicable diseases in Nigeria.
Thank you.
Yes.
We have some questions here which are very interesting. One which says that cancer does not occur in rural areas, that it is it is, whether we call it a myth, that it only occurs because of Western influence, Western food, and is therefore only found in urban areas. How true is this?
Well, of course, this is not true. I don't believe there's any rural area in Nigeria where one form of refined urban food does not exist. So it's therefore very simplistic to assume that cancer doesn't exist. However, you're quite correct. This is a very common impression that our people hold. Some even attribute it to spirits and so on. The Hausa name for cancer is Chiwondaji, something of the forest, disease of the forest, So it doesn't, it's not true. There are associations with a highly refined diet, and this tells us, goes to what we were talking about, that our own local, unrefined, healthy diet is the best. And everywhere in the world, they're moving towards a more organic and a less chemicalized diets.
Yes, thank you. Now, is there an issue with stigma with cancer patients? And if there is, how can we overcome it?
Yes. Just like in other diseases, like HIV and what have you, people still do believe that cancer is communicable, even though it is in the front line, list of non-communicable diseases that cannot be transferred, by, exchange of just body fluids, or by touching, or by, what have you. But of course, these are the associated needs, that exist out there in our population, particularly in the rural areas. And the myths are not only restricted to the rural areas, even in urban areas. You see people asking this kind of questions, like what Her Excellency said earlier, the daji they said in our traditional parlance, they will tell the patient, if you go to the hospital and you agree for you to be given an injection, it will automatically kill you. And unfortunately, in most cases, it is the inability of the patient to come to the hospital that makes the disease to advance very much. By the time they come, they are already at terminal stages of these diseases. It has gone everywhere in the system. And of course, even when treatment is instituted, the probable outcome is usually not very good. And when the patient dies, they will say, we have said it. So we need to eliminate, we need to erase all these stigmas and, allow, people to present to the hospital very early,
If I can ask Her Excellency, is FLAC able to address some of these issues of stigma and misunderstanding? Because it actually plays such a huge part in the presentation and the ultimate outcome in a lot of these patients.
That is the core objective of FLAC, to address all these superstitious myths and misnomers that exist as a result of a awful combination of illiteracy, poor education, awareness, and lack of information. So we exist to pass on the right information to our, when I say the grassroots, I mean our rural, uneducated Nigerians that are living in the hard-to-reach remote areas of the country, by feeding them with the right information and also, very vitally, supporting the care. When you interact with our people at that level, you realize that a lot of things they do are born out of a lack of availability or lack of ability to access anything better. So once you say, oh, this treatment can be provided for you at a highly subsidized rate, or this diagnosis even can be provided at your primary healthcare center or at the general hospital in the capital at a highly subsidized rate by the government, and then you will find that it's taken up much more. In Kebbi, we have an indigent cancer fund that the government is sort of like the Cancer Health Fund. The state government puts a pool of money, and then other stakeholders and well-to-do in the society are encouraged to donate to that fund, and it is disbursed by the Cancer Control Department of the State Ministry of Health. And it's a very simple process. The patients apply and they're treated. The other access thing that we do is to enter into partnerships with drug manufacturers so that the drugs that they need are highly subsidized. There's a cut from the manufacturers, the pharmaceutical agents. We provide drugs for prostate cancer totally free, and some of the breast cancer ones, Herceptin, which is from one of the pharmaceutical companies, Roche. So these, when it's available and made available to the people like that, then we find that more and more come up, and we honestly cannot meet the demand, even as it stands.
Thank you very much. Are there any other myths that you would like to dispel on this program now? Any other popular ones?
I think you've touched the two important ones. That is the other one that, well, it's not a myth really, but it's the health-seeking behavior that people tend to go to the traditional rulers, traditional healers, and it's all related to the lack of availability of proper healthcare services within their area.
Dr. Adamu?
Yes. Well, yeah, as rightly stated by Her Excellency, the major issue we have is the lack of access, lack of availability. This is the reason why many, especially in rural areas, are pushed to go and seek for alternative, healthcare, particularly with the traditional healers.
Can I challenge that? You say that it's a lack of availability. I would actually want to argue that they actually seek it because that's what they know. Because sometimes they actually have access. They have primary care centers and even general hospitals in the vicinity. But because that is what they know and that is what they're more comfortable with, that is actually where they go to first. So how do we move them from that superstitious behavior into actually seeking proper care?
Yes, an uninformed mind, is an ignorant mind. And of course, sometimes, people do make these choices, thinking that they are the best choices. So, and as rightly stated by Her Excellency, the core essence of organizations like FLAC and a lot of our organizations that are working at the level of the grassroots on the, cancer awareness. And this is actually creating a large bandwagon effect, especially in recent times in terms of information information dissemination, in terms of proper awareness creation. People are now talking more about cancer than before. And, and of course, when you look at the statistics, you see a situation like the statistics highlighted by Excellency at the beginning. Prostate cancer now overtaking cervical cancer in terms of the prevalence rate and all that. It's all because of awareness. Now people are presenting to the hospital. These cases are getting documented, and of course, the lack of access, for example, now the Cancer Health Fund that is in play, with breast, cervical, and prostate cancer being taken care of, at least for indigent patients, those patients that cannot afford, care. It has created, a sort of an awareness that there is something out there that is going on. The CAP, the Cancer Access Program of the Federal Ministry of Health, whereby patients, pay 50%, and the government and the pharmaceutical company in collaboration will take care of the other distance. These are all measures that are making people to access care more. And of course, we will continue to amplify the voice. We'll continue to, talk, particularly through our partner organizations that are working at the level of the grassroots. And of course, organizations like the organizations of the various first ladies at the state level working on cancer will go a long way, because we know our people, we know how they think, and once, the first ladies take this ownership, they go down and people listen to them, people listen to whatever it is that is coming from them. And I'm telling you, a lot of lives are being changed. Kebbi State is a typical example of what is happening, in the country in terms of, access to care by patients, particularly from the rural communities. The statistics in that state is quite amazing.
Thank you. Dr.
Yeah, I'd like to just add two things to what Dr. Adamu enumerated about how we can, to answer the question you asked on how we can address this lack of health-seeking behavior in the proper way by our people, and the fact that sometimes even when the facilities are available, they don't go. For me, there are two simple things. You need to work with community gatekeepers. If we sit here and we talk about it all day long and we just tell them, even me as the governor's wife that is considered to have some influence at my local government level, I don't walk into any village and just say, oh, go to the hospital, take your drugs. I first of all go to their traditional ruler. I go to their religious rulers. These are the community gatekeepers, and these are the people that they have been conditioned to listen to and believe. So without working with these people, none of our programs will succeed. Whatever it is, health, education, agriculture, empowerment, we must always seek their buy-in, train them, equip them with the right information, provide access to care that they need, listen to their needs, not just hand them over well-designed programs that might not be adequate for them. What are their particular needs in that area, and how can we close the gap? The second thing that really helps that I've found out is showcasing the positives. Like we said, most of our patients tend to come at a later stage. So the narrative is cancer, you go to hospital and you allow them to touch it, you are dead. Yes, of course, because even without touching it, death is just around the corner in a stage 4 fungating breast mass that has spread to all the organs. So by the time you're taking off the breast to give her a more comfortable life for herself and the people around her, it's just cosmetics. It's just a toilet mastectomy to make life more palatable for her and the rest of her life. But they don't understand that. They think by going to hospital, you're offering treatment for this end-stage cancer, and that is not the case. So when we have the positive cases of the earlier ones that are detected and have received adequate care, then we must showcase them and we must get them to champion the cause. Unfortunately, it's not very common. Last cervical cancer elimination day anniversary, I searched the length and breadth of Nigeria for a cervical cancer survival, and I couldn't find. I found one patient that was undergoing treatment and she died 2 weeks after. So it's a very, very difficult thing to find somebody living a healthy, normal life. Breast cancer we tend to have, but for cervical cancer, they come late and the disease has already progressed.
Your Excellency, can you give us a few last words for our listeners?
Thank you for highlighting the burden of cancer in Nigeria, especially as it affects the common man. The solution lies with us and prevention of cancer. We have to learn to adopt a healthier lifestyle, stay away from the causative agents as we know them, and believe that all we know about cancer is based on scientific research and a lot of data. And the countries that are able to overcome it have been able to overcome it through robust health systems, early screening, regular screening, and also improving their lifestyles, doing away with sugar in carbonated drinks and so on. So I'd like to use this opportunity to call on all your listeners, if nothing else, try to adopt a healthier lifestyle so that we can get towards that cancer-free life.
Thank you so much. I want to say thank you once again for your taking the time to be on the program, Your Excellency, and also Dr. Adamu from the Nigerian Cancer Society. Thank you.